Hello, everybody. My name is Kelly. I'm a senior research nurse from Addenbrooke's in Cambridge. Today, we're joined by Steve, who has very kindly offered to share his experience of taking part in a clinical trial. So, to start with, I'm going to ask him to introduce himself. Steve, I was wondering if you could just give us your name, age, and tell us a little bit about when you were diagnosed, how you came to be involved in clinical trials, and how long you've been on the trial for.
Okay, thanks, Kelly. Yeah, I was first diagnosed in, I think it was in May 2022. I'd
Mhm.
originally gone to see my doctor in late February, early March, because I was having a few problems with my waterworks. He was a little bit concerned, so he gave me an examination, and he decided to do a PSA test. He sent that away. A couple of weeks later, he called me back in. He said he was sorry to tell me that my PSA was 56, which was really high. And he said he wanted to refer me to go and see the urologist. So he referred me to the urologist. Everything was happening quite quickly. I got a urologist appointment. He re-examined me, looked at the PSA, and said he was concerned that I did actually have prostate cancer. And he wanted to send me for a CT scan and a bone scan and for me to have a biopsy. So he just told me to go with whatever came first. So if the CT scan came first, go and have that. Don't, wait, do one before the other. It didn't really matter. So I went for a CT scan and a bone scan also. And the results came back from that in the fact that I did have some cancer and it spread into my pelvis, just a slight amount, but it was actually in the pelvis, sort of metastatized. I can't say that word.
Metastasized,
That's,
yes.
yeah, that's the word. Um, I went for the biopsy, and the results of that came back, and that wasn't good at all. I had a Gleason score of 9, which showed that I had advanced and aggressive prostate cancer. At that stage, I was given a number of options. I was asked if I wanted to do chemotherapy. I was also given the option of radiotherapy. And I decided at this stage I would do both. I'd obviously not spoken to any of the teams at this time, but I wanted to go ahead and explore those. And at the same time, I was to be put onto hormones. And it was at this point that they mentioned the hormone trial. And that trial was called, well, it still is called Stampede. The bit that they wanted me to go on, or they asked if I was interested in going on, was to do with an alternative form of getting the hormones into the body. So basically, the standard way was a 3 monthly injection, but they were looking at using hormone patches, which released estrogen directly through the skin, to try and affect the cancer or kill the testosterone, which I think both do,
Yeah.
maybe in different ways.
Yeah.
Yeah.
What were your thoughts when your kind of healthcare team first mentioned clinical
Uh,
trials to you? Were you
was
worried at all?
Yeah, I think I was quite positive. I was
Hmm.
open-minded about it. I
Yeah.
think from day one, after the initial shock of being told I had this advanced prostate cancer, I've always been very positive about it.
Yeah.
So I think, yeah, I was open-minded. Obviously, there were a number of questions going through my mind.
Yeah. What
Um,
sort of questions did you have?
uh, I wanted to know what the side effects might be in having the hormone patches, um, and I also wanted to know what did I just say side effects?
Hmm.
Yeah, what the side effects were.
Yeah.
Um, what the trial was all about, get more understanding of the trial.
Yeah.
What I didn't say there was, at this point, the trial had two bits. There was a control group, that would take the normal injections, and there was a second group who would have the hormone patches. And at this point, I didn't know which one of those groups I would be in.
Yeah.
So maybe that would still go in the group that had the normal jabs, or I could actually get the hormone patches. But as I said, at this point, I didn't actually know that, so I just had questions around that basically.
Yeah. Did you have any, I mean, obviously you were worried about side effects. Were there any other kind of anxieties or concerns that you had about taking part in a clinical trial?
Not really. I suppose the only thing is you always wonder, if I do this, rather than taking the standard option of treatment, which is well tested and well known, then am I not going to be as well? Is it not going to fix it as well? But I suppose that's the whole point of having the trials in the first place, and they're trying to establish that in looking for better ways of treatment.
Yeah, no, absolutely. Who do you think kind of like what do you think actually kind of helped calm you? Was were the research team the ones that you initially kind of spoke to? Did you speak to a doctor about it first, or was it a research nurse?
No, it was a research nurse. She was very, very, very nice,
Yeah.
and she explained everything to me. She told me I was under no obligation to join the trial. It was purely my decision.
Yeah.
They gave me a lot of literature, which they asked me to go away and read. So I went away and I went through all the literature, so I had a full understanding of what was going to happen, and that answered a lot of the questions that I'd had in my mind anyway. And I did have a discussion with the actual consultant at the hospital, and he was the consultant that was responsible for the trial for that particular hospital. So I had a good chat with them, which sort of got rid of some of my worries.
Yeah. And did you get a chance to speak with your families and friends about it? Because I know sometimes we often say, it might be helpful to speak to family and friends. Did you do that?
I didn't. I must admit, I didn't speak to friends about it particularly at this point in time. I spoke to my wife. My wife was slightly anxious about it, but my wife's an anxious person anyway. So, but we both looked through the papers together. We both looked at it, and I mentioned it to my son and my daughter. They were all on board with it. If that's what I wanted to do, then that's the way I should go.
No, that's amazing. So what actually, in the end, what made you choose going on the trial over doing the kind of standard,
Well, as I
kind of
say, at this
procedure?
stage, I wasn't even sure whether I was going to get the patches or the
Yeah.
jab. So, my main motivation for it was I've got a son and I've got two young grandsons, and my understanding was that if I've had prostate cancer, that they're more at risk of getting prostate cancer in the future. So I wanted to do something that may potentially help them going forward and make the process and everything a lot easier for them if they were to be diagnosed with it.
When you were kind of put onto the study, when you were randomized to the arm that you were, which arm did you actually get in the
So I
end?
did actually get the hormone patches.
Yeah.
So I went and had a chat with the research nurse, and she explained what the process was. So basically, she showed me how to apply the patches. I had to apply 4 patches twice a week, so I had to change them Tuesday and Friday.
Yeah.
The patches could be put on any part of the body, the chest, the upper arms, the buttocks, the upper thigh. So a number of different areas.
Yeah.
Although that area where you were putting the patches had to be clear of hair. So if you're a sort of hairy person, you
Yeah.
had to shave that area first before you
Yeah.
put the patches on.
Yeah.
So I think I went on those in about the June time. I think I started using the patches, and I did have some problems with them right from the
Did you? I was
start.
just going to ask that actually, if
Yeah,
you had
yeah,
any side
sorry,
effects.
yeah,
No, you're fine.
yeah. It was quite a hot summer. I tend to be a little bit of a sweaty person, and I found it very difficult to get all the patches to adhere to the
Okay.
skin. So obviously that caused a few worries in terms of were you getting the right level of
Yeah.
hormones. and things. I was told if a patch came off, you weren't to replace it.
Yeah.
So there were a few worries there. They were quite difficult at times to apply.
Yeah.
You know, even taking away the fact that they weren't adhering. If you're trying to put them on the back of your shoulder or something, it was a little bit
Yeah.
awkward. And you had to make sure that you didn't use the patches on the same area of skin twice in a row. You had to give the skin a chance to calm down. And initially, I didn't have any problems with that. That was working quite well. Although after probably about 5 or 6 months, I found that when I'd taken the patches off, my skin wasn't recovering. I
Okay.
was having a sort of reaction to them. So I had red
Yeah.
blotches all over my skin.
Oh, gosh.
And although I tried to persevere with them, I
Hmm.
decided at that point that I couldn't do it anymore. I don't think it was being very good for my skin. So I asked
Yeah.
to come off the patches,
Hmm.
which they were very obliging, said, yeah, you can come off the patches. We'll just move you over to the control group.
Yeah.
So at that point, I went on to the normal 3 monthly jab cycle.
Yeah. And how was that? Did you find that the kind of side effects you were having, did they clear up?
Yeah, my skin cleared up. Yeah,
Hmm.
definitely. I didn't really get any other side effects from the patches other than those blemishes on the
That's
skin.
good.
Maybe a little bit of because of the type of hormone it was, the estrogen,
Yeah.
and it being a female hormone,
Yeah.
maybe developed some extra breast tissue
Yeah.
and things like that. But it's not something that's bothered me. I'm not that body conscious, so but some people might be.
Yeah.
So
And have you found any difference between kind of having the patches and then being on the kind of
no,
control
I don't
group?
have any problems with the
No.
jabs at all. Yeah, I mean, I get a little bit of tiredness, but I think
Hmm.
that's sort of standard. And the consultant asked me, well, he told me it would be a good idea to take calcium and vitamin D supplements for the bones
Yeah.
because I believe the jabs and the hormones can make your bones a little bit more brittle.
Yeah. Yeah.
So, so yeah, I've been fine with the jabs ever since. I'm still on the trial now, so
Yeah.
I think it's
How long have
good.
you been on that for again?
Well, I joined in June 22, so nearly 2 years.
Gosh. Yeah.
And I think the bit of the trial that I'm on, I think Stampede is a larger trial and there's
Yeah.
different areas of it. The area that I'm on, which was particularly to do with uh, whether patches are any better or at
Mhm.
least as good as jabs for people with metastatized
Mhm.
prostate cancer.
Yeah.
Um, yeah, that bit runs for another 2 years, I think.
Yeah. And what do you think is kind of the best thing about being on a clinical trial? What is there a best thing about being on a clinical trial?
I don't think there's any. Oh, I mean, obvious. You can have side effects. I could
Yeah.
have side effects from the jabs. There's going to be, whatever you tend to do, there might be downsides to it.
Yeah.
But I think if people don't sign up to the trials, then it makes it very difficult to progress any other types of medicines or treatments that will
Yeah.
help people in the future,
Yeah.
and maybe do away with some of the side effects that you might get from one treatment, give people a better choice.
Yeah. No,
So I
absolutely.
think I'm happy that I'm helping,
Hmm.
hopefully helping in doing
You will be. Yeah. I think sometimes because I work in the surgical urology side of
that. All
things, and
right, yeah,
I think when you're in the oncology side, you're very well supported by the staff there anyway. And in
yeah,
the kind of surgical side, it's slightly different. So we
yeah,
always say about clinical trials that, you get more support in some ways because we're constantly wanting things from you in,
yeah, yeah.
respect to, information about how you're getting on and all of that. So we have like a regime that we follow quite
Yeah.
closely.
I mean, obviously, there was a bit. The other upside of it is
Mm,
that there's a bit more testing, so you are
yeah,
looked at a bit more regularly than you would be on the
yeah,
jabs. So when I have my jabs every 3 months, I have a PSA test at that point. Whereas when I was on the patches, those tended to be a bit more regular, and other types of blood tests as well.
yeah,
So that there's that side as well. You're being watched a little bit more closely.
Yeah, and did you find that? I know some people find it slightly more annoying to be coming back for those extra tests. Did you find that an issue?
It didn't affect me. I'm quite lucky, I suppose, in the fact that I only live probably 15 minutes away
Oh,
from hospital. We're quite lucky in Leeds that we've got two very big hospitals, and I live very close to both, so
yeah.
it didn't affect me. But I know of people. I know one of my wife's friends. He had prostate cancer, and he was having to travel across from Cumbria across to Northumberland, basically on a
Mhm.
daily basis. So I can imagine for some people, yeah, that would be a problem. It wasn't for me, fortunately.
Yeah, no,
Yeah.
that's good. You said obviously you're a very positive person. You have been from the
Yeah.
beginning of your diagnosis. Did being on the clinical trial affect you in any way, like mentally or emotionally, whilst you were on the trial at all, or were you
No, I
absolutely
don't.
fine?
No, I don't think it did. To be honest, no, I just take every day as it comes. To be quite honest, but
Yeah.
obviously, there are people that it would affect. I think
Mhm.
if they tend to be the anxious types of people,
Yeah.
then it wouldn't be too good. I mean, when I was doing the trial, obviously, I don't know if I don't remember now what I said, but I signed up for chemotherapy and for radiotherapy. So I was doing the patches at the same
Mhm.
time that I was doing my chemotherapy,
Yeah.
which I did from June till October 2022, and then my radiotherapy in early 2023.
Yeah.
So I suppose it's difficult as well with side effects and things to know
Yeah.
where
Which
those
one
side
first?
effects are actually
Yeah.
coming from.
Hmm.
Um, but now obviously I've been clear of those for over a year now. So
Yeah.
I don't, as I say, other than the tiredness,
Yeah.
don't really see any problem with anything.
Were you working at the time that you were diagnosed,
I
or?
again, luckily I wasn't. I
Yeah.
retired very
Yeah.
early, so I think that was a plus as well.
Yeah.
So I didn't have to worry about work or anything like that, or I had no financial worries or anything
Mhm.
like that. So yeah, that was a good thing. And in terms of its effects on me, I suppose I've still done the things that I've always done.
Yeah.
Maybe I have to reel in a little bit now when I get tired. I have to know when to stop.
Hmm.
I've always had a tendency to overdo it, or my wife tells me I've got a tendency to overdo it. So when I get tired, I know I've got to stop now, where as before I might have just carried on and been
Yeah.
okay.
And if someone came and spoke to you about going onto a clinical trial, what would you say to them?
I think obviously discuss it with your research nurse, with the consultant, with your family, your wife, your partner,
Hmm.
whatever. Get every other people's views. Ask lots of questions. Make sure you're in your own mind. It's what you want to do. Don't feel pressurized into doing it, because um, you don't have to be. It's your choice at the end of the day. But also consider the good that you might be doing, maybe not for yourself, but for other people that are coming down the line. And that's
Yeah.
the way I've always seen it. I'll do what I can now to give back. I've had a really good service from the hospital, from all the staff. Everything's being rushed through. I know it's not always the case, and I'm lucky that I'm in Leeds and we've got these great hospitals.
Mhm.
Um, but yeah, I've had so much help that I just want to give as much back as I can.
That's really kind. That's really nice to hear. Is there anything else that you'd like to say about your experience of being on a clinical trial?
I think I've probably covered everything. I did make some notes, and I've not looked at them once, so I don't think so. I think I've actually covered everything that I wanted to say.
Mhm.
Yeah, no, I'm pretty sure that I've covered it.
And you mentioned about your sons and your
Yeah, yeah.
grandsons, and them being kind of, one of the reasons that you decided to do the trial. I know obviously with prostate cancer, there is that link that,
Yeah.
if it's genetically linked, it can pass through to your sons. But were they proud of you for doing the study? Did they realise that actually they were a bit of the reason why you did it?
I think my son definitely did. My grandsons are 10 and 12, so they're getting to
Yeah,
that understanding
yeah.
sort of stage. So yeah, I think they probably were, and I did explain it to them that it might help them
Hmm.
in the future if that it could make things easier for them.
Yeah, no, that's great. Well, thank you so much for sharing your experience with us today, Steve. That's
That's
really, really
great. Yeah,
kind.
I'm
It's been
glad I
great.
could can be of help, and I'll
No,
continue to be as long as I can.
thank you. That's perfect. Thank you.
Okay. Thank you very much, Kelly.
Thank you.